30 seconds.
Minister, to ask the Minister for Health, the respite care services available for parents and guardians of children with intellectual disabilities in CH4, and if he will make a statement on
Minister.
First of all, thank you, Deputy Pat Buckley, for raising this particular issue, because in relation to this government's ongoing priority of safeguarding of vulnerable people in the care of the health service, we are committed to providing services and supports for people with disabilities which will empower them to live independent lives. As part of its ongoing service provision, this year the HSE will provide over 182,500 overnight and 42,500 day respite sessions right across the country. I am informed by the HSE that in the context of the respite services in Cork and Kerry, it is recognised that the expansion of respite services for people with disabilities is essential to support families to continue to care for their family member with a disability, and particularly those with significant disabilities. In Cork, respite services are provided by the COPE, the Brothers of Charity, Co-Action, St Joseph's Foundation and Enable Ireland. CHO has a progressive development of a respite, has a house in West Cork, and this house will open on a phased basis from this month and will be open to referrals for respite across County Cork. A number of alternative respite services have been very successful in Cork, with over 800 children and adults benefiting. In Kerry, the HSE funds adult respite services for people with intellectual disabilities, which are provided by Kerry Friends and Friends Association, and the St John of God service is operating at full capacity since the beginning of July. And I visited that house myself during the summer holiday period, which gives 1,460 bed nights per year. In 2018, the HSE CHO4 has provided over 17,000 respite night and 2,000 day respite service to people with disability, and over 900 people with a disability have been assessed respite services across CHO4. Finally, of course, we are acutely aware that families need support to care for their loved ones at home, and therefore the Government is committed to provide a range of accessible respite care supports for people with disabilities and their families, and we will be giving the families more choices in relation to development of respite services.
Minister, I thank you for the answer, but just on, I suppose, a reply from one of the PQs that we submitted back in quarter 17 to quarter, I suppose, 2 of 18 this year, the actual services numbers have gone down, the hours. But I was interested to hear that you are fully committed, and you've said, right, in one of the answers we got, it was the target actions to improve supply. There's absolutely no mention of Cork in it, there's no mention of Kerry in it. It's Dublin, Dublin, Dublin. So it's an alternative plan to me. On the other side of it, Minister, it's very strange. It says here the provision of residential respite services has come under increased pressure in the past couple of years, not weeks and months, to days, years. You know about it. Why isn't anything been done? We're getting the same answers over and over again, repetitive, yet the services are being cut, but the demand is getting greater and we're getting no concrete answers on it. Can you give me an answer to that?
Minister.
The funding for disability services are not being cut. And if anybody says that, you're misleading. Our people working who are saying that's wrong. There's an extra 150 million being put in disability services in 2019. Now, can I go back to the core issue of today's questions? The bottom line here is, in relation to respite services are being developed, and an additional 10 million was provided over the last couple of months and has in 2018 for respite services. And I've seen the 12 houses and I've visited them. And the find of the 12 new houses is being completed in the next week or two. So in each CHO area, and 3 in the Greater Dublin area. 10 are new additional centre-based respite centres have been opened today. So let's deal with that issue. Of course there are issues in relation to, do we need to develop more services? And I will be working with organisations like COPE in Cork, the Brothers of Charity and St Joseph's Foundation and Enable in Ireland. And in addition, funding allocated to the Cork-Kerry Community Healthcare has been utilised to progress the development of a respite house in West Cork. And this House will be open on a phased basis on December 2018 and will be open to referrals for respite across County Cork. Of course, we've started investing in the services. Of course, we're catching up, because I do accept the point that the services are underinvested. But the reforms have begun, the investment will go on. But what I'll say to people as well is we're going to put the funding focused on the person with the disability.
Thank you, Minister. Again, this is referring to HO4, Cork and Kerry. I never mentioned CHO 7, 8 and 9, which is Dublin.
So which you want now?
You're on about services. Money you mentioned, I'm on about actual hours and services. But I'll go on here, and this is part of the HSE's reply to the PQ that we put in. There are a number of factors impacting on the increased demand for respite and increasing the number of children and adults who are seeking to access the respite as a reflection of the general population increase. So we know the population has been increasing year in, year out. Still no planning for this, no forward planning. An increase in levels of complexity across the sector due to improved healthcare, an increase in the age of the population with a disability, resulting in people presented with challenging and changing needs. We've known this all along, still no forward planning. But the greatest answer on the bottom of this is the HSE is fully committed to delivering much-needed new respite services and supports by the end of 2018. I don't think you're going to have anything ready in the next 5 weeks that will help any of these people.
Minister, just hold a minute.
Minister, and can I just say...
Minister, sorry,
yes.
Two short supplementaries, Deputy O'Brien.
All right, okay.
Deputy Moynihan. I want you to make them very short.
Okay, I recognise the funding for disability services has increased. There's no one denying that, right? But, Minister, there is a fundamental issue here. There's more money going into it. There's less services coming out of it. There are more people on waiting lists. There are less hours being provided for people. Something is not working, and we need to get to the bottom of it. The transition from child services into adult services is an absolute disaster. People who have respite, who have day services, the minute they turn 18, they're gone. They're put on waiting lists all over again. We need care paths. And, Minister, it's not just a case of money. It's about good management and good strategies being put in place.
Moynihan, short supplementary.
You mentioned there in your earlier reply in relation to St. Joseph's and Charleville, how many extra nights were available for respite through that organisation in 2018 as opposed to 2017?
Thank you. And finally, short supplementary, Deputy Doherty.
I want to focus in relation to the number of overnight respite places that are available. In CHO1, which includes my own county of Donegal, there has been a 1/3 cut in the number of overnight places in terms of respite from Q2 2017 to Q2 2018. 1/3, over 400 nights out of the system. Now, you can talk all about increases in budget, and we're not disputing that, but the reality is, for parents on the ground, the services are getting worse. 1/3 cut. That's the reality. You can shake your head all you want. The figures are there. I can give you. It was 1,334 last year in Q2. This year it was only 900. Now, how you can suggest that that's an improvement or a stabilisation or an increase in service is beyond me.
Minister, make the best of 1 minute.
Yes, can I just say the facts are this year the HSE will provide 182,500 overnight and 42,500 day respite sessions right across the country. In relation to the HSE CHO4, that has provided 17,000 respite nights, 2,000 respite day service to people with a disability, and over 900 with a disability have access respite service across the CHO. But Jonathan Bryan's point is a very important point. Yes, we're putting in the region of 1.8 billion into our social care in 2019. And there are issues with that money and that funding. And my objective is, and part of my debates regularly with the HSE and the Department of Health is, how come not enough of that money is filtered down to the points that Pearse raised in relation to respite service and disabilities? And I accept that argument, and that's something. So what I've set myself 3 objectives is to invest in the services, and please don't say cut. But the second issue is reform the services, and I accept that. But number 2 is, and by the way, I've been talking to the parents in Kerry and parents in Cork and parents in Donegal, and I am listening to their individual care, and I will push those issues, because I do accept the points. If there are gaps there, they have to be dealt with. But to say what we have to do is invest in the services, reform the services, but there has to be a change in the mindset in this House as well as the broader House, the HSE, the Department of Health, everybody. The focus has to be on the person with the disability. That's my job as Minister of State, and that's my focus over the last 3 years.
Pringle to introduce his question.
That's my call. So this question is in relation to the Seaview Respite Care Home in Donegal Town, which has recently been handed over from the HSE to rehab care for the provision of respite services for children and young people, or all people with an intellectual disability. So I want to know, Minister, what the Department of Health views are in relation to that, and how the Department of Health will see that that will actually improve the services that are available, because the HSE couldn't recruit staff to run the health centre, so I don't know how the private sector can. Thank you.
The Minister has 2 minutes.
Yeah. Thank you, Lascannor. I want to thank Thomas Pringle for raising this very important issue. Again, I want to put on the record in this House that this government's ongoing priority is the safeguarding of vulnerable people in the care of the health service. We are committed to providing services and supports for people with disabilities which will empower them to live independent lives. Early this year, as I said earlier on, we provided an extra £10 million to the HSE to open 12 additional respite houses across each CHO area. These houses were fully operational and will provide 19,000 extra overnights and 2,520 home sharing nights annually, which is the funding of £10 million. £2 million of that extra money is being targeted to alternative respite services, and I forgot to mention that earlier on. These are practical and important solutions: extended day services, summer camps, Saturday clubs, and they are making a difference to families right across the country. Now, in relation to Thomas Pringle's question, I am informed by the HSE that in the context of respite services in Seaview Respite Home, Mount Charles, County Donegal, that Seaview House is owned by the HSE and there are no plans of transferring ownership of this facility to a third party. The HSE is engaging a third-party provider to deliver respite services at Seaview House as a result of ongoing challenges in providing a consistent respite service, which has resulted in considerable reduction in the amount of respite available for service users in South Donegal area. And now I'm beginning to see the other issues that you talked about, Deputy Pearse Doherty. But in relation to this issue, there has been a considerable reduction in the amount of respite available for services in the South Donegal area. The tender process is now complete and a provider has been provided to deliver this care. The HSE is confident that this new arrangement will be in place by the first quarter of 2019. There will be a planned transfer from the HSE to a new provider to minimise disruption to services and to ensure continuity of care. But this is something that I will keep a close eye and make it a priority.
First supplementary.